Hello, this is Dr. Rod with 17th Street Chiropractic, and this week I'd like to talk to you a little bit about chiropractic in a scientific, physiological kind of way. There's a lot of different theories and explanations about chiropractic out there. You might have heard subluxation theories and how it affects the nervous system and how it can affect your overall health as far as making your asthma go away or your stomach working better. I want you to forget all of that right now. I want to go back to the basic principles of physiology and how your body works to explain how chiropractic can actually make you feel better in a scientific kind of way, in a way that you understand and it makes sense. So the first thing I'd like to talk to you about is about your joints. Because that's what chiropractic does. It affects the joints. So you have many joints in your body, okay? And especially in your back, in between each one of those bones, you have two joints in each one of their sides. So you have many joints in your back, okay? The way that joints work is they are alive. They need, just like any other part of your body, it needs nutrients, and it also has to discard waste from them, okay? So it's not a static dead thing, it's alive. So it's in constant need of the nutrients to keep itself alive and to discard all the waste products that it doesn't want, and it's actually toxic for it, okay? So keeping that in mind, how does the joint actually works? Well, it doesn't have much blood supply that goes straight into the joints. Actually, some joints don't have any blood supply at all, okay? Most joints get their nutrients from the surrounding tissue, from surrounding fluids. So what it does is, whenever you're moving, whenever you're walking, whenever you're bending, whenever you're reaching, your joints, they're moving. And the joints work kind of like a syringe, okay? Whenever you move and you imagine I have a syringe in my hand, and you pull on the syringe and it sucks all that fluid in. That's the same thing that happens to the joint. Whenever you move, the joint opens up and the fluids around and the tissue around there sucked into the joints, and that's how they get their nutrients, and that's how they survive, okay? And when you move again, the same thing happens again, but on the opposite direction. The syringe is pressed on, and the fluid is expelled with all the waste products and toxins and all that. So that's why it's important to always keep your joints moving. Now, what happens if that exchange doesn't happen? Well, just like any other tissue of your body, it dies, okay? Any part of your body needs nutrients, and that it needs to get rid of the waste. The joints the same way, it dies. And you can see that with time by your joints actually degenerating. They actually start to grow bones in the ways that they shouldn't. They're not as strong. They're not moving the ways they are supposed to. They start to calcify. That's the joint dying or degenerating, okay? So that's why it's so important to get your joints moving all the time, okay? Nowadays, mainly because of our posture, and it could be other things like trauma, a lot of those joints are affected, and they actually get stuck together, okay? They don't move the way they should because our muscles are all pulling your part of the bodies in the ways that it shouldn't. Our bodies are actually imbalanced because of your posture, and the computers, the way we sleep. So those joints, they actually get stuck in a way that they are unable to move. If they are unable to move, they cannot exchange fluids and release waste. Therefore, they start to die. That's when you start seeing arthritis, osteoporosis, all kinds of nasty things happening. And of course, you start having pain because the joint's sick, so you're gonna feel that pain because it's not happy with what's going on because it's dying. So you're gonna start having pain. So what we do as chiropractors in the basic physiological level is, because your posture is not correct, because you don't sleep right, and because you have those joints get stuck, what we do is release that with a chiropractic adjustment. What chiropractic adjustment does is actually put some motion into the joints and make it unstuck. It makes it, let it move again the way they're supposed to. That's why some of the pain goes away. We talked a little bit about last week about the notion of having motion receptors and pain receptor, and that's it too. But it works on a second level by releasing all the toxins and lets the joint get its nutrients again, so the pain goes away. So that's a basic function of a chiropractic treatment. It's help your joints move the way they should, and to help them actually receive the nutrients, eat, and expel the waste, so they don't die and you don't have immediate pain and future problems with degeneration and joint death, like arthritis and things like this. This is Dr. Rod with 17th Street Chiropractic. I hope this was helpful.